The debate over healthcare is very controversial. The issue is whether healthcare is a fundamental right and should be the government's responsibility to provide or should be individually sought out. Some Americans argue that universal healthcare will erase direct and hidden costs shared by all, while extending coverage, lowering costs, and improving quality. However, others argue that the requirement of healthcare infringes on personal freedom and also will not lower but raise the taxpayer's cost. Here's Obama on his healthcare plan.
Here are the details that every American needs to know about this plan. First, if you are among the hundreds of millions of Americans who already have health insurance, nothing in this plan will require you or your employer to change the coverage of the doctor you have. Under this plan, it will be against the law for insurance companies to deny you coverage because of a pre-existing condition. As soon as I sign this bill, it will be against the law for insurance companies to drop your coverage when you get sick or water it down when you need it the most. They will no longer be able to place some arbitrary cap on the amount of coverage you can receive in a given year or in a lifetime. We will place a limit on how much you can be charged for out-of-pocket expenses, because in the United States of America, no one should go broke because they get sick. And insurance companies will be required to cover, with no extra charge, routine checkups and preventive care, like mammograms and colonoscopies, because there's no reason we shouldn't be catching diseases like breast cancer and colon cancer before they get worse. If you lose your job or you change your job, you'll be able to get coverage. If you strike out on your own and start a small business, you'll be able to get coverage. We'll do this by creating a new insurance exchange, a marketplace where individuals and small businesses shop for health insurance at competitive prices. Now, for those individuals and small businesses who still can't afford the lower-priced insurance available in the exchange, we'll provide tax credits, the size of which will be based on your need. For those Americans who can't get insurance today because they have pre-existing medical conditions, we will immediately offer low-cost coverage that will protect you against financial ruin if you become seriously ill. This was a good idea when Senator John McCain proposed it in the campaign. It's a good idea now, and we should all embrace it. But an additional step we can take to keep insurance companies honest is by making a not-for-profit public option available in the insurance exchange. Let me be clear. It would only be an option for those who don't have insurance. No one would be forced to choose it. It would also keep pressure on private insurers to keep their policies affordable and treat their customers better.
Here's what Michael Cannon said on June 2nd, 2009 on C-SPAN.
When it comes to quality, the quality of healthcare in the United States, the good news is that America's healthcare sector leads the world in producing medical innovations like MRI scanners, CT scanners, mammography, drugs and other treatments for cardiovascular disease, and these innovations save lives not just here in the United States but around the world. The bad news is that the way we deliver medical care in the United States is often dangerous and backward. We lack sufficient evidence about what works and what doesn't. Even when we know what works, patients only get evidence-based care about half of the time. Doctors typically do not coordinate the care they deliver to a shared patient. And American patients suffer an estimated 180,000 serious medical errors in hospitals every year. Each of these problems is in turn caused or exacerbated by the fact that American medicine lacks basic technologies available in all other areas of our lives, like electronic record keeping, which could be making medicine better, cheaper, and safer.
Here's what Pam Kukis has to say on America's healthcare reform.
I think it's incredibly important, both because we have a lot of people who don't have health insurance in this country. We have a lot of people whose health insurance doesn't do what they need it to do. You know, it's too expensive, it doesn't cover things. My brother has like a policy on the individual market because he's opening his own firm, and, you know, he's paying for his own doctor's bills on everything. And so there's just not enough choices and not, you know, enough affordability for a lot of Americans.
Although some people have different opinions on healthcare.
He sees this bill as the greatest threat to freedom in his 20 years up here on Capitol Hill. Do you agree with that statement?
You know, I do agree with that statement. You're talking about a sixth of our economy. You're talking about putting a bureaucrat between individuals and their physicians. And you're talking about, look at what's happening to Medicare with this bill, where you're going to make $500 billion in cuts to Medicare, and Medicare is a trust fund. It is not a slush fund. And we are hearing from so many of our physicians who are saying, my goodness, if they're going to tie my hands like this, how would I end up doing my practice? We already have too much paperwork. We don't need more government interference in healthcare. We need...
Healthcare is a very important issue, in my opinion. I believe that we should not reform the healthcare system because the nation is in way too big of a debt, over $13 trillion, and the nation just cannot afford to spend money on every person that needs healthcare. It should be up to the individual to buy their own healthcare, because it's just not the taxpayer's responsibility to pay for those who can't pay for themselves. There's no incentives to work hard and get money so you could buy your own healthcare.
As you can see, healthcare is very controversial and is still up in the air for debate.